Hello, my name is Aurelio Fernandez, and I'm the President and CEO of Memorial Healthcare System. And we're mandating all of our employees to get vaccinated because we need to stop the spread of this virus. And right now, the science leads all of us to say, get vaccinated and you will avoid getting the virus. We have seen a rapid increase in the number of COVID patients coming to our facilities. Today, 40% of all of our patients are COVID positives. We have the highest number of COVID patients in our facilities of any other healthcare system in Broward County. This has resulted in us expanding our bed capacity and utilizing and converting conference centers, auditoriums, cafeterias, and even building a search unit over at Memorial Hospital Miramar. But I do need to let you know that this is not unique to Memorial Healthcare System. The spread of this virus is throughout South Florida and more recently throughout the state of Florida, specifically in Central Florida. There is nothing more important for the safety and well-being of our employees, our patients, and the community. In order to handle this, we are mandating everyone in the organization to get vaccinated. We continue to take steps to avoid the spread of this virus through our facilities. We have adequate PPEs, but we are challenged by staffing. Just last week, we approved the recruitment of 150 more traveling nurses to help augment the number of staff necessary to care for our patients. In addition, we need to be mindful that schools are opening, and with that comes the opportunity to spread the virus. You'll hear more from Dr. Knapp.
Hello, I'm Dr. Mark Knapp, Chief Medical Officer of the Memorial Healthcare System, and I'm here to talk with you about something that is extremely important. We as an organization have come to the decision that we need to require everybody in the Memorial family to be vaccinated against COVID-19. Healthcare organizations all across the country have started to do this, including organizations in our own backyard in South Florida. The vaccine has been out now for roughly 8-9 months. Fortunately, a large percentage of the population did get vaccinated, but a significant percentage of our own staff have opted not to get vaccinated. As healthcare professionals, we take our oath to serve extremely seriously, and we follow the science. We use the science to help us make decisions about what's best for our community and our patients. It's hard to argue with the science right now. The likelihood of any consequences of taking the vaccine are extremely remote, and yet the risk of infection is very significant. I recognize that women of childbearing age and women who actually are pregnant are concerned about getting the vaccine and whether or not it's safe. Both the American College of Obstetrics and Gynecology and the Society for Maternal Fetal Medicine have both come out with public policy statements strongly advising women to get the vaccine, even if they're pregnant. My own daughter, who's pregnant, got the vaccine. We're seeing women in the hospital now who are pregnant, who are incredibly sick, and it's heartbreaking. I also want to talk to you about the fact that school is now open and that our own children and the children in our community are going back to school. We are seeing cases of COVID in children like we didn't see in the past. Right now, we've got 15 children at Joe DiMaggio Children's Hospital hospitalized because of COVID. That's far higher than what we saw in the past. Some of these kids are very sick. Now, while children under the age of 12 can't get vaccinated, children 12 and above absolutely can. And I feel just as strongly, if not more strongly, about making sure they get vaccinated than even that the rest of us get vaccinated. And I really want you to know that while this may be unpopular for some people, it's really the right thing to do. And I think we will all be better off for it. And at the end, we'll get through this faster and more safely, and we will save more lives. I really want to thank you very much.
You know, I've had the opportunity to walk down the halls of each one of our hospitals, and I've seen how hard everyone is working. I've gone over to the converted conference centers and auditoriums and cafeterias, and how the staff is working together to provide safe care. But unless we get vaccinated, this is going to be a long journey. We appreciate everything you do, and let's take this virus seriously.